Hey, Matt Sitter here, CEO of AFN. At AFN, one of our central beliefs is that change is where opportunity happens, and the best way to find opportunity in change is a network that is diverse in experience, expertise, and perspective. With the fireside chats that we do, we look to bring forward different parts of our network who are subject matter experts in specific areas to help us learn about some of those things that we might not otherwise know about. Today, we've got Rich Bryson from the Spirit Health Foundation with us. Welcome, Rich.
Thanks, Matt. Good to be here.
And the Spirit Health Foundation, I'll let you describe what it does, but Rich has extensive experience in strategy and marketing as well in general in the healthcare area. And you've done a little bit of work in mental health support as well. So I think that there's a lot of things that we could actually tug on in terms of where your personal interests lie in healthcare. Can you tell us just a little bit about the Spirit Health Foundation?
Yeah, thanks, man. Yeah, good to be here. I think I'll start with the problem in terms of the problem we're addressing. So we still have over half the world's population can't access essential health services, and that's reflected in the same way in sub-Saharan Africa, where my foundation operates. And it's complex, but to put it really simply, it's typically people living in rural communities that live long distances from facilities. There's a real lack of health workers, a lack of resources, equipment, access to basic screening. And the result of that, unfortunately, is still a lot of lost livelihoods, a lot of lost lives, and a lot of those are actually preventable if you can connect them to the right solutions. So, in terms of Spirit Health Foundation, so my passion, certainly in the second part of my career, has been all around increasing access to healthcare in low-income countries. A fundamental belief that everyone should be able to get the healthcare they need to protect themselves and their families. And there was a coming together with Chris Barker and the Spirit Health business, who share this passion. They share this passion for expanding health for all, and they have the technology platforms, particularly a platform called CliniTouch, which I'm sure we'll come on to, and a full range of health services to be able to address this problem. So what we did about a year ago, so we launched in September last year, is we set up the Spirit Health Foundation. We're an independent non-profit, but the way we work is we provide Spirit Health's CliniTouch platform, unlimited licenses, and a full range of services: clinical, technical, capacity building, solution design, and we provide that free to non-profits working in countries in sub-Saharan Africa, and then work alongside them to build smarter health systems that can improve and save lives in those countries, and to do it in a really sustainable way. And yeah, so that's how we set up the foundation back in September 2023.
Great. And I'm interested in how you guys ended up picking sub-Saharan South Africa as the first place to work, because you said 50% of the world's population has insufficient access to healthcare. In Africa, I think it will be very interesting over the next 50 years to be able to see, because it's one of the spots in the world where you got actually have the population growing, and there's going to be a lot of future entrepreneurs and successful businesses that are coming out. But how do we make sure that that population is actually, healthy enough to be able to meet that promise that's there? How'd you pick Sub-Saharan Africa as the first spot that you guys were really looking to make an impact?
Yeah, so first of all, I mean, there's been a lot of progress in countries in sub-Saharan Africa, particularly some countries in terms of innovation, expanding health for all. Remarkable progress in areas like under 5 child mortality over 20 years. Last 20 years, that was reduced by 51%. So there's been a lot of really great progress, but there's still significant challenges in that region. There's still challenges from infectious diseases like HIV and TB. There's now the growing impact of non-communicable diseases like cancers, diabetes, cardiovascular diseases, and maternal and newborn health is a real challenge. So maternal deaths, unfortunately, 100 times higher than in high-income countries across the region overall, and neonatal conditions are still the biggest killer. So there's big problems still to address, and there's challenges that get in the way. So there's a real commitment from a number of countries to expand universal healthcare for their populations, and there's some great organizations, non-profits working on the ground. But there's things that get in the way. There's, as I say, lack of health workers. There's a 10 million shortage worldwide. 6.1 million of that shortage by 2030 are in sub-Saharan Africa. and there's also just a lack of resources. So you can't just build the systems in the way they've always been built. You've got to look at smarter solutions. And the role we see our playing is not to say we've got all the answers and we're going to come in and provide the solutions. We're providing a way to amplify and enable existing organizations, non-profits on the ground, often working with government at a community level, to be able to deliver services for more people and do it in a more effective and efficient way. And that's the opportunity that we can really help with and have an impact with, because ultimately, digital health is at the heart of what we do, and that's what digital health in the right way, applied in the right way, can really achieve.
How, when you're thinking about these nonprofits that you're working with who are really, going to be the ones who are helping
Mm.
drive the solutions here, how are you finding those partners to work with?
Yes, so I mean, first of all, we think carefully about the partners. So it's important when we're working with partners that they have key things. So they're already delivering on in the communities, so they have that trust in the communities through the work they're doing, and are able to mobilize community health workers, which are the core of our model. We look for them to either be have experience with digital tools and innovation, or be open to doing that with our support. And we also, thirdly, look for them to have a really sustainable and scalable model to be able to scale it up in the health system. So there's things we look at to be able to ensure we've got the right partners in place. And obviously, they're making that same selection with others as well. It's a two-way process. I think the key to it, we're not a foundation that's just kind of like, here's the product, off you go, or here's some funding, off you go.
Yeah.
We're looking to work hand in hand with them. And so obviously that's both remotely, but it's also spending time with them in the communities on the field so that we can really understand the communities. And I think that's where partners come together. The challenges come around if you don't really understand the community's needs, how the health system works in those communities, and how you can best apply the solutions that you've got through this platform, CliniTouch, to be able to deliver it. And so that's really the key, is working really hand in hand with partners to be able to make that happen.
So when you're working with a partner and they're utilizing your solution, how do you measure success of what you're doing on it? What are some of the particular metrics that you look at to say like, all right, this is having the impact that we want it to?
Yeah, so we've got our overall big goal that we've set is by 2030, enabling 30 million people to get essential healthcare in underserved communities, and that's both a focus on mothers and under fives through antenatal care, postnatal care, under five monitoring, but also screening and referring and monitoring adults across a broad range of health areas. The focus at a kind of initiative level, the key things that we'll look at is if you're equipping community health workers with CliniTouch to go and provide education, screening, monitoring in a community, how many people are we educating? How many are we screening through that community health worker workforce? But then the way CliniTouch works, it then connects to a facility. So a person at a health center or a hospital is reviewing the information, and through the smart algorithms in the system, you get a red, amber, or green. So you can then refer people based on if they're red or amber into a health center or a hospital, or enable a video consultation. So as well, it's the education and screening and monitoring and those numbers. It's also really important, ultimately for us, that we're also getting people into care. So that's what we really focus on, is how many of the people we've actually identified that need care are coming into a facility or are having consultations for a video consultation. And then we will also then track that ongoing. So if you've been, for example, you've had screening for diabetes and you've been referred in, if you come in and you're then treated, we'll then track that over time in terms of how you're keeping your diabetes under control, how you're preventing more serious complications. So we'll track that over time as well in terms of the impact. So it's really trying to make sure we're looking at all those aspects of the health system, but with the community at the core of it.
How long does it take to get a sense of the impact on outcomes, that person who's getting their diabetes under control?
Yeah, so I mean, I think in terms of diabetes over control, so that's going to be over the longer term. So typically, I mean, if we're going in to operate for a 1 year period for that first phase of an initiative, You might call it a pilot. Don't like to call things pilots because it's like, pilotitis and all that. But like, I think it's that first phase. What we're really looking for is, have the community health workers, are they using the tool effectively? Are they educating, screening? Are we seeing those numbers into care? I think you're then tracking over time, probably beyond that, over the next 2-3 years and potentially beyond. What are the outcomes you're seeing for patients who've then come into care? And then also looking at that at a population level. So how have we been able to impact a population overall? And then how can we replicate that model somewhere else to have even more impact?
You talked about the NGOs, the partners that you got on the ground who are helping you put in Touch and like products. What other partners do you have to work with in a country, in a selected community, to be able to get rolling?
Yeah, I mean, I'll probably use the our work in Eswatini as an example there. So as I mentioned, that's focused in maternal and newborn health. So it's a big focus for us. In kind of the way I described at the beginning, if you're a mother in a community, or parents in the community, you just can't get access to the level of antenatal and postnatal care you need. So what we're doing is looking to deliver more of that through community health teams as well as at a facility, so they can get those 8 antenatal contacts, 4 postnatal contacts, to be able to protect them, spot risks and complications. So that's a really big area for us, and something I'm really personally passionate about as an area. The To mobilize it, there's obviously the partner. So we've got a great partner there, Elizabeth Glaser Pediatric AIDS Foundation, which some of you may know. Done some amazing work in HIV over the last 30 years, now broadening into broader primary healthcare system areas. But then there's obviously a load of other kind of people you have to get engaged. So you have to, obviously government and the Ministry of Health. So there's parts of that ministry in Eswatini focused on community health. There's those that are focused on the kind of systems side, those that are focused on sexual and reproductive health. So engaging all those different parties and making sure they're involved in how we're developing the solution is really, really important. And I'd say a lot also alongside that, probably, the most important thing is the communities themselves. So you don't get anywhere unless you really build trust and relationships with the community. So that's community leaders, that's influencers who in the communities. It's obviously the public health providers, in this case of the Eswatini initiative, and the community health workers. And you only really get that, obviously, if you're working with a partner who obviously have a relationship, but also involving them in the solution is absolutely critical. I think there's that Steve Jobs quote, which is kind of start with the customer and work back. So my version of that is start with the community and work back. You've got to start with the community.
Right. And so you've got these partners that you're working with. Obviously, you can't be running around everywhere on your own. So you've got to hire people to help do the work within these local communities. Uh, how are you thinking about this from the broad perspective of leaders of an organization, to be able to select someone who can work with a heck of a lot of autonomy, but really ingratiate themselves with the community? What's that selection process look for you? How do you go about finding the right people to do this sort of work?
Yeah, it's a great question. It's also a very pertinent question in terms of the recruitment we're doing at the moment. So obviously with Spirit Health Foundation, we're really fortunate to have some great people from across the Spirit Health group who are kind of clinical, technical, implementation, tech, experts that are supporting the foundation through its work. Our model, to kind of lead to the point around people on the ground, we're going to have a regional manager responsible for Southern and Eastern Africa, which is where a lot of our work is focused and going to be focused in the near term. And then our model for going into each country, as well as having the partner there, we then look to recruit based on the funding, a country manager who can work on the ground, and work alongside the partners, and obviously work closely with the communities and the government. I think in terms of the profile of that person, so it comes down to the delivery. That's it's you need strategy and you need to work through the approach, but ultimately it's about, can you deliver, and not just deliver in a one-dimensional way. I thought before, when in the first part of my career, when I was working maybe in healthcare in more high-income countries, that we used to kind of learn, improve, optimize all the time. But like it's at a different level when you're working in this setting because there's so many things you're working through, you need to improve and enhance. So I think that's one. I think secondly, you need people that are really resourceful. I think to your point, Matt, you want people that can kind of deal with those problems on the ground, can probe into where there's particular issues. So that can be anything from, community health worker needs and do we, have we made the solution simple enough for them to be able to implement effectively, through to interoperability with the health system. So someone who can understand the kind of technical side as well. So I think it's those two things. And then yeah, thirdly, it's about the passion and the conviction. It's not an easy area. If you want if you want an easy life, this is not the space. But ultimately, obviously, the reason you're doing it is the impact. You want to improve, save lives in communities that don't have access to the healthcare they need. And so, what we look for is people who are just so passionate about that and share our passion to do it.
And is the goal to have people who are already living in the community, or do you want to be able to pull folks out from other parts of the world? How do you think about that?
So it doesn't necessarily need to be from the community, but definitely from the country. So
Yeah.
that's super important because I think the whole model you need to be humble. I think as we're a UK headquartered organization, and I've obviously worked in a number of different countries, including in that region. But actually, the reason we work with partners, the reason we want to also recruit people from the countries themselves is they understand the communities, they understand the culture, they understand the systems, and we're there to help and enable them to be able to build the health services it needs. So it's very much from the country.
Um, so as you're, putting in Clinitouch in certain spots, as you're, getting this into communities, any surprises that you've had in terms of implementation that was like, I assumed it was going to be like this, and it's actually positive or negative, right? I'm happy to
Yeah.
hear that. A good surprise for you.
Yeah, so I mean, just to kind of back up, just the I guess with the so everyone's clear on the model in terms of how we work, and then I'll explain some of the things that might get in the way of that. So we work through community health workers, which some of you may be aware have become a big part of trying to bring care into communities, bring it close to them. People recruited often from the communities themselves. So we have a platform called Clinitouch, and Clinitouch is for a community health worker on a mobile phone, on an app, and they can provide education, they can provide screening and monitoring through questionnaires, they can capture clinical readings, and that's customizable for any area, so any health area whatsoever. And it can work offline. And the way it works, they capture that information with the community member, and then the information is then sent through the system. The smart algorithms generate this risk score I referred to earlier, red, amber, or green, and that means they can then intervene. The key things I think that you learn, simplicity is such a key principle of ours, but often, however simple you think you're being, you need to be simpler. So um, just and I think I've learned this. I think certainly I've learned this in previous roles. Is actually community health workers, you want to make it as simple as possible for them to capture only the information they need to. Don't give them any more than they need to do to capture the information for that particular goal. So if you're trying to provide an antenatal care interaction for a community health worker, just what are the key things that need to happen at that stage of the pregnancy. Don't give them lots of other information and data, and that's what often can happen, and community health workers get all this.
Yeah.
So I think the kind of simplicity, I think you learn to just really keep it very simple. I think a second key area which we're really focused on, which is hard but so important, is interoperability. So very, to put that in kind of straightforward terms, meaning if we're capturing information through our platform on a phone and through the Clinitouch system, that information can be shared into the clinic information management system or other tools, so you can see that same patient wherever you're trying to deliver care across the health system. That sounds really simple, but it's not, and it's become, as many of you I'm sure will know, it's become a real issue because you've got all these digital tools competing against each other. So one of the things with Clinitouch is we've put we based it on the FHIR standards, so fast healthcare interoperability resource standards, and that if you've got other FHIR systems, it makes that sharing much simpler. But I think there's a lot of work still to do in countries to get that interoperability working, because ultimately, if you don't have that, you're creating probably more confusion, which is the opposite of what you're trying to do, and you're potentially going to create more inefficiencies, which again, obviously, is the opposite of what you're trying to do.
Right, right. All right, so simplicity is a big thing, and making sure that folks can actually use what you're putting in front of them, that they're not being overwhelmed by other information that's out there. If it's
Yeah.
going to be a useful tool, it's got to help them get done what they need to get done.
Exactly. Yeah. I mean, you've got to keep the kind of mindset on that all the time. It's around the hardest thing is delivery. Like, and I think that's true of any organization in any sector. Like the vision and strategy, you need great strategy, but you also, how you deliver and execute on that is the key. And when we're working in settings where there isn't a normal health infrastructure, there isn't a normal health education understanding, there's shortages of health workers, focusing on that delivery and working out how you do that and do that in the most impactful way, that's it's so important.
So you brought up the shortage of health workers a couple times. So,
Yeah.
if we think about, uh, does the work that you're doing, is the intent that, all right, we're making this person more productive, therefore they can see a lot more people? Or how do we attract, or are we saying you could actually take someone who is lesser trained and being able to bring them into a position where they can deliver care, and therefore we can solve that? How do you approach that sort of problem?
Yeah, I think it's right on both aspects. So yeah, as I mentioned earlier, there's this 10 predicted 10 million shortage by 2030. Over 6 million of those in the countries we're working in sub-Saharan Africa. We're not going to address that human gap. Um, and so, what does technology do? Particularly a lot of the AI technologies that are coming through, they augment the ability of those health workers to deliver a lot more. And secondly, it enables you to task shift, as to use the terminology we use, to less kind of to different types of health workers. So community
Right.
health workers versus a health worker at a facility. Um, so yeah, that task shifting is absolutely important. So if you look at what we're doing, community health workers, without the tool we've got, they can go and probably provide some education. They could do some manual paper-based referrals, but with the system we've got, they can become a much more effective and efficient way to screen and monitor for any health area. And they can also, because the smart automation then enables us to identify who needs to be referred, they can play that role in referring people into a clinic. So what that means, therefore, for a facility, whether that's a health center or a hospital, that are short on resources, they can really focus the resources they've got on the right people at the right time. So yeah, technology, obviously, what it does and has done for many years, it's doing it in a much bigger and more much more progressed way, is it augments and it enhances the ability of humans to be able to deliver. And that's important everywhere. It's, there's lots of issues across health systems all over the world in terms of efficiency not being able to meet the demand, but this is kind of life and death in where we're working, because people just can't access healthcare at all. And so that's what it's able to support with.
So, like any CEO that's out there, you're thinking about the resources of your organization. We talked a lot about the human capital already, how you're hiring people in it. The financial capital on, a nonprofit is different. You got to be out there. You actually got to be, bringing money to bear so that you can do these things. How are you going about that capital raise piece for Spirit Health Foundation?
Yeah, thanks. So obviously our model is supported by Spirit Health. We provide all this platform and services, normally millions in a commercial market, and we're providing that for free. But we do need external funding. So our model for every new country we go into, so we'll set up, as I've described, with partners on the ground, and we'll implement the types of initiatives and services I've talked about. But we need that for that country manager and some of the expenses to be able to go and do some of the training, some of the tech setup, for using the teams that we've got from Spirit Health and myself. We need around 70K a year, £70,000 per year, to put it in pounds, per year for country to be able to set up. So that can be for a couple of years, it could be 3 years, sometimes it may be longer if they need us. But the
Yeah.
model is not to for us to be there forever. We're looking to, it's just 70K per country to go and have a huge amount of impact. And then what we're looking to do as soon as we're able to do it is to train up the partners, whether that's the non-profit or the government partners, to be able to run those services themselves. And that's why we provide the unlimited licenses, access to the
Okay.
library, all the different services. So our involvement, in the grand scheme of kind of global business and global health, we can have a huge amount of impact to go into new countries for £70,000 per year to be able to go and have that impact. And that's what I'm kind of looking to fundraise for at the moment.
Okay.
Because actually, that's in many ways the only real limit on the impact we can have. I mean, we've set this 30 million goal. My conviction is to do way more than that because there's way more need than that. But we need partners to be able to do that, and that includes fundraising.
Okay. So, and if I understand correctly, when you were talking about the just the efficiency of putting out capital on this,
Yeah.
70,000 pounds is, there's a lot of setup cost around this in terms of getting up and rolling, but presumably over time that um the amount that you have to be supplying into this can go down because you're training up the local partners against it. You
Yeah,
all
spot
have
on.
some maintenance that you're doing, but
Yeah, spot on, Matt. I mean, it kind of varies, but if we take it, let's put a practical example. We're going to a country, so we're providing kind of the millions ongoing in terms of in-kind funding of the platform, the licenses, all that services, and that's ongoing. There's not a limit on that support in terms of the licenses and the platform. And our kind of way of working is to say like to train up the local partners to be able to run that by themselves in a sustainable way through whether that's through the government system or it's a social business model. The only requirement we need is for a certain period, and say that can be depending on what's happening in that country per year. It's 70,000 per year. So if we're in a country, say for 5 years, that's 350,000 for that 5 year period to be able to go and set things up and kind of ensure that the initiative can be sustained over the long term in that country and that population.
And just as a practical pursuit for you, the world's a
Mm,
big place. There's all sorts of folks that you could be trying to raise
yeah.
money from to be able to do this. Is there any areas, geographically, industry wise, any like folks who you are focused on? And it's just like, hey, these are the people who want to have the impact on where we are working towards.
Yeah. So, I mean, at an overall level, the way we look at funding partners who, and it's not just also the funding, it's also like the other capabilities that they can bring in, work together. So
Cool. Yeah.
who else, either organizations or individuals, they want to do the same thing that we're trying to do and have this
Okay.
impact on health in countries across sub-Saharan Africa, particularly in women's and children's health, where we focus and improve and save lives. So that's the overriding way we look to kind of build those synergetic relationships. There's certain kind of I guess kind of sectors we're looking at to be able to do that and have done so far. So that can be the kind of corporate private sector where you've got other foundations
Yeah. Yeah.
um, in global health, but also more broadly, particularly those that are focused on and issues like gender equality or technology as a kind of medium to kind of address inequities. We're also looking at kind of also can be looking at private individuals and kind of family offices and those that have that impact, as well as kind of the multilateral kind of UN type agencies, as well as kind of government as well. So I think one of our key principles is about partnership. So it's about trying to bring together the right partners in the right way to basically have impact and a bigger impact together. So we do have those focuses, but yeah, people who are listening to this either themselves are think they could partner with us, or they know people who might be able to. We're really open to that because yeah, I'd like to move more quickly than we are, and we can do that through partnerships.
Right. And I love how you started thinking of, like the first thing out of your mouth was there's complementary services out there that can be able to help us out. So everyone can get more leverage if you're partnering with the right people as well.
Yeah, definitely. I mean, I think if you look at also some of the challenges, I mean, if you take like telecoms companies, for example, so all our services require devices. They require it does work offline, but there's a certain degree of connectivity and data credits you need. So I think this is the way we're going to solve this challenge, which is still a huge challenge. You think like we're in 2024 and still got over half the world's population, over half the world, population in countries in sub-Saharan Africa can't get essential health services. So it feels like we're way behind where we need to be. And so partnerships are the way we will address that if we
Right.
collaborate together. And so one of the things we've also, was a founding principle is we won't duplicate efforts. If there's already solutions where it's delivering what's needed for communities, we won't get involved. We're not trying to do that. Our model is amplify impact, and that's why we're
Yeah.
working with existing organizations.
Awesome. Yeah, I mean, I think that the clearly what you guys need is the right communication and energy infrastructure to be able to do some of these things. And those are certainly areas where there's some opportunities in sub-Saharan Africa too.
Definitely, yeah, yeah. I mean, there's obviously issues around, yeah. So if you, I mean, let's say we've got the mobile side that the community health worker uses, that can be used offline, which is obviously really important. But there's 2.6 billion people still offline in the world, so they don't have access to the internet, and that's not even like meaningful connectivity. So devices, smartphone devices, where you can use different services, and there's obviously a huge opportunity there, which is very synergetic to the work we're doing.
Okay, so if people are interested in uh, thinking about how they can contribute to Spirit Health Foundation, what they can do to partner with you, or if they're like, hey, I believe in what you're doing, how would they go about talking to you?
Yeah, I mean, hopefully we'll share my details with the network. I say I big believer in partnership and collaboration to be able to solve this problem. So I'm really open to, even if people are kind of thinking, oh, this could work. I'm really open to that discussion. Ultimately to be able to deliver in a new country and impact more populations, improve and save more lives, we need a really good partner in the country. So if people kind of watching this, know really good nonprofits working in countries in the region that could think they could benefit from the support that we're providing and could work with us, that's one opportunity. And then secondly, obviously, is the funding partners who could come in and bring their own capabilities, and we can work together to be able to deliver. Those are the two key things that we need in place to be able to expand in a new country.
Awesome. Rich, immense pleasure talking to you today. Look forward to being able to talk to you again sometime soon.
Yeah, pleasure, Matt. Yeah, really, really great story. Thank you for having me. Yeah, and yeah, I hope it was valuable to people listening and watching.